Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. The Dissect and Connect podcast is a service of Montgomery County Prevention Partners and New River Valley Community Services. Dr. Dana L. Cunningham serves as Vice President of Community Outreach and Engagement for Black Mental Wellness, a Washington, D.C.-based group founded by clinical psychologists whose mission is to address mental health issues that are prevalent and unique to the experiences of Black people. She obtained her bachelor's in psychology from Spelman College and obtained her master's and Ph.D. in clinical psychology from Southern Illinois University at Carbondale. Dr. Cunningham is a licensed psychologist in Maryland and has provided mental health services to culturally diverse children, adolescents, and families in a variety of settings including community mental health centers, inpatient hospitals, juvenile detention centers, schools, and her private practice. She is passionate about increasing access to mental health care and decreasing mental health stigma in the Black community. Since 2006, Dr. Cunningham has served as the program director for the Prince George's School Mental Health Initiative through the National Center for School Mental Health at the University of Maryland School of Medicine. In addition, Dr. Cunningham serves as the co-facilitator for the National Practice Group on Cultural Responsiveness and Equity through the National Community of Practice on Collaborative School Behavioral Health. Lastly, Dr. Cunningham is a training consultant for Strategies for Youth, and in that capacity, she provides trainings on adolescent development, mental health, and trauma to police officers throughout the country. Her research and clinical interests include the development and application of evidence-based practices for youth of color, resilience, and trauma-informed practice. Dr. Cunningham, welcome to the Dissect and Connect podcast.
Thanks for having me, Mike.
We are delighted to have you join us. So I wanted to, first of all, get you to, if you would, share an overview of Black mental wellness and tell us a little bit more about your organization.
Yes, absolutely. So Black Mental Wellness is an organization that was started about 2 years ago, really with the intention of creating a space that was focused primarily on mental and emotional behavioral health wellness for Black people. We realized that there is a lot of stigma associated with mental health, particularly in the Black community, and really wanted to provide a space where we could share resources, provide information to the larger community, and provide an opportunity to also highlight Black professionals in the field and really work collaboratively with other organizations to produce content and share information related to mental health for the Black community.
I feel like there's so many directions that we could take this conversation, and I definitely want to come back and touch upon some of the things that you've just mentioned, but just kind of out of the gate, let's talk about COVID-19. And as a clinical psychologist, I wonder if you might be willing to share some of your general concerns, short-term and long-term, about the pandemic and its impact on our mental well-being.
Yes, the COVID-19 has, I think, had an enormous impact on everyone's mental and emotional health. Certainly creating a lot of anxiety, a lot of depression. We've seen loneliness. Just the economic impact as well in so many families and communities. It's just really far-reaching. Not to mention all of our children who've been educated at home and have lost opportunities to engage with their peers, and for some to have food even on a regular basis. So it's I don't know anyone who has not been impacted in some way by COVID-19.
The other thing that obviously I think we'd be remiss if we didn't discuss are the current events around social unrest and racial injustice. Similar to what we talked about just now with COVID-19, can you talk a little bit about the impact of what we're seeing play out right now?
Yeah, I think we're seeing a lot of different emotions that are being displayed, from anger and rage to feelings of helplessness, anxiety, depression. I think for so many Black people, we've experienced and expressed how frustrated, we've been for years over the way, particularly Black people and people of color have been treated by the by the police and, the larger society related to issues related to discrimination and injustice. And oftentimes those voices have not been heard or responded to in a way that was always very helpful or welcoming. And I think, I'm definitely very encouraged by a lot of the action that has taken place more recently and the additional conversations that have taken place regarding, racism and police injustice. And, I'm glad to see that it seems like there's some momentum related to some of those issues moving forward. But certainly we have a long way to go and have a lot of work to do.
And I was actually going to ask you if you felt like there might be an opportunity for things to improve with what we're seeing right now.
Yeah, absolutely. I think, I've been encouraged by the number of people and organizations that have really seemed to have stopped and really paid attention finally to what has been voiced for so long. And I think COVID has had something to do with that a little bit, just in the sense that, so many people were already feeling, as I mentioned, already anxious, already depressed, feeling isolated, already had some emotional vulnerability. And most of us have been at home as well and have had more time, see the news and see what's going on in the country, and have really kind of stopped and paid attention. I think COVID also, highlighted a lot of disparities in our country related to healthcare and access to care. And so, all those things coupled together, I think, created a lot of momentum around some of the more recent issues that have been brought to light. But I'm definitely hopeful and optimistic that the change will continue and that this will be, a year from now, people will still be having these conversations.
So what's the best way for people who aren't Black, aren't of color, to help ensure that there is real meaningful change that is an outcome of the situation?
Yeah, that's a great question. I think there's, a lot of work to be done. I think one thing that, is just definitely taking some time to understand what the issues are, getting some understanding about the history of systemic racism and white supremacy in the country, understanding what some of your fellow colleagues and neighbors and friends have been experiencing for so long, and really, taking some time to learn and get invested in what's happening in our communities. Really, advocating for change at multiple levels, whether that be, at locally, with police chiefs in your community or what have you, and really connecting with other organizations that are doing the work, providing financial support or just, some manpower to kind of carry their messages across and assist with carrying out the missions of some of the other organizations that are kind of on the front line.
Let's talk about the importance of culturally competent behavioral health care. Why does that matter?
That is huge, and it's so important for many people of color. When they do go to a mental health professional, they want to feel understood. They want to feel that their experiences are valued, and that they don't want to feel, they want to feel respected. And want to feel like the interventions and suggestions that are being provided to them resonate with their culture and their experience. And so, if someone goes to a provider who isn't culturally competent, doesn't take the time to understand what their experiences have been, or if they mention, they've experienced racism or discrimination, that isn't belittled, or, they aren't made to think, oh, you imagine that. Those experiences are important. And if you're going to talk to a therapist and you're being vulnerable and sharing things, you want to be able to trust that person. And if you have a provider who's not culturally competent, it can be hard to develop a really good working relationship where you feel like you're able to trust them to do the work to move forward.
And I guess the other side of that is, and I actually just read this in an article the other day, is that there is a noticeable lack of Black providers, professionals in the field. How do we address that?
It's a great question. I think we definitely need to, one of the disparities related to education. To become a mental health professional, you have to go to graduate school. There's issues related to access with regard to school and barriers related to the whole educational experience, for one. But one of the things, too, that we've tried to do at Black Mental Wellness is to increase exposure to other Black mental health professionals. So for, many Black children growing up, they may not even know that or know any other Black mental health professionals. And so, we've tried to increase exposure so people, young children can see, someone that looks like them. It's possible, it's feasible to become a licensed mental health professional.
Yeah. You mentioned stigma early on in our conversation, so I wanted to dig a little deeper into that and talk about stigma among the Black community and what some of the factors are there.
Sure. Yes. There's a lot of stigma in the Black community, particularly as it relates to mental health services and seeking mental health services. What we know, unfortunately, oftentimes in the Black community, if there was a mental health issue that was expressed, quite frequently the response has been, we'll just pray about it, or, you're tough, you can get through it, you don't need to talk to anybody about it. There's also been the response or the thought that, you can kind of just talk to friends and they'll help you kind of figure it out. You can get some social support from them, which is true. But sometimes we need a higher level of professional support as well. And then there's also, some issues related to distrust, in the medical community. Sure. I mentioned before, not being able to access a culturally competent provider. Sometimes that certainly is a barrier as well. But oftentimes not really having that understanding about sort of what to look for in a mental health provider, how to choose one that is helpful for you, can sometimes be a barrier as well.
Let's talk about the impact of trauma on the Black community.
Sure. Specifically, if we think about, racial trauma, which is a form of, race-based stress that's experienced by people of color. And so, if they experience consistent discrimination, prejudice, threats, shame, witnessing harm come to another person of color because of their race, or, seeing someone get humiliated or denigrated because of their race, that's a traumatic, that can elicit traumatic responses and feelings in someone. When we think about the emotional impact of that. And in many cases, it's not just one time, it's on several incidents that we've experienced, multiple microaggressions. And, those experiences can result in feelings of fear and anxiety, confusion, guilt, blame, and so it definitely takes an emotional and often physical toll on people in the Black community. And it's definitely a valid experience that oftentimes, I'm glad that more recently it's been being discussed and talked about, but, sometimes there have been incidents, where people have tried to express their experiences related to racial trauma, and, it was not well accepted.
Mm-hmm. You have extensive experience in working with culturally diverse youth, and your research and clinical interests are specifically around working with youth, and you've done that in a variety of settings, obviously. I also read an article the other day that noted that there was an increased rate of suicide among Black youth, particularly girls. Is that an issue you feel comfortable in speaking to?
Sure, we can discuss that. Yeah. I think I've also seen research that suggests that there were higher incidents of suicide rates in young African American males.
Mm-hmm.
I think generally the research points to the fact that we have a generation of young Black boys and girls who are really struggling emotionally. Oftentimes, feeling unheard, feeling mistreated. We know that bullying is a huge issue now, particularly related to social media and the increase of that.
Right.
A lot of kids are bullied there, and there was a lot of issues as well related to the LGBTQ population of young Black children, and depression. And again, I think some of it goes back to feeling like if a child is experiencing some sort of emotional distress, that they can't talk about it with other people, feeling uncomfortable sharing their stories and sharing their experiences. And so this really speaks to the importance of advocating for all voices to be heard and to be accepted and supported.
Which brings me to the children's book that you wrote, A Day I'll Never Forget, and that it was written to support children who are impacted by parental incarceration. Can you talk a little bit more about that book and why that topic is of importance to the Black community?
Absolutely. In the United States, unfortunately, Black and Latinx populations are incarcerated more than any other country. We incarcerate more people in general, but certainly Blacks and people of color are disproportionately impacted. And so with so many Black people being incarcerated, then obviously they have family members, their mothers and fathers and brothers and sisters. And so, my clinical work, I had, when I worked in a high school in Baltimore at the time, I had started interacting with a lot of clients who had experienced incarceration of a family member. Mm-hmm. And, at the time I was looking for, some resources and information. I like to use bibliotherapy and working with clients, and couldn't really find what I was looking for. So decided to write a book about it. But it is really a critical population that often doesn't get a lot of focus. We often talk about, reentry of people who have been incarcerated and, how important that is. We talk about recidivism rates. We talk about kind of some of the factors that lead to people getting incarcerated, but really thinking about the impact that it has on their family. The children are often one group that often gets kind of left out of that conversation at times, but it's a huge impact. For mm-hmm. many children, it's very traumatic to have their a parent or family member go to prison or go to jail. And so I wanted to provide a vehicle for adults to share and have some conversation with children about that experience.
And talk about a scenario that has long-term implications. I mean, that an incarcerated parent, serious issues potentially for a young person in that situation.
Absolutely, yes. We see, some children may experience, depression, anxiety, confusion, and such shame. There's not, when you lose a parent to incarceration, it's hard to talk about that. There's not, people aren't waiting, welcoming you with open arms to say, hey, let's talk about this experience. And so there's often not a safe place because of the stigma associated with mm-hmm. that. For kids to talk about their experiences. And so it's kind of shame built on anger, built on depression, and, all of those emotions kind of colliding, which is why it's so important for kids who are experiencing the incarceration of a loved one to be able to have some support from family, from home, to be able to deal with that difficult situation.
You also briefly mentioned the challenges around access to care for the Black community. And the COVID-19 situation is obviously a perfect example of why that's a problem. In a webinar that I attended the other day, I was so glad to hear someone reframe the headlines that we're seeing around the higher prevalence of COVID-19 cases among the Black community. And this person made a valid point that it's not because of the color of a person's skin, it's because of the health inequities. Access to care, poverty, all those factors that play into that. And I was so glad to hear someone make that point. Can you talk a little bit more about just health equity in general in regards to the Black community?
Yes. Yeah. We see that so much in our communities just in terms of being able to access care. Something as simple as getting to a doctor's appointment can be challenging mm-hmm. for families, not to mention lack of transportation, but it could be You have maybe there's 3 or 4 other kids at home that a parent has to care for. So, can you get all those kids with you?
Right.
Can you find a babysitter? And then once you get to where you're going, sometimes there's often discrimination or negative experiences that people experience once they get there, or misdiagnosis, or providers not taking their symptoms seriously enough, or other experiences that they have where they feel invalidated, and so may not want to pursue treatment. But there's also issues related to obviously insurance. If their insurance does cover a doctor's appointment, then maybe there's a copay, and maybe there's not enough money, for that copay, particularly when we're talking about COVID. So many people have lost jobs and are unemployed now. And so if I have to make the choice between groceries for my family or, going to this doctor's appointment, I might have to choose the groceries for my family.
Sure.
So there's so many barriers to accessing care and accessing good care that we definitely have to attend to.
Are you hopeful that the advent of technology and things like telehealth might help with that in some ways?
Absolutely. So my main job, I'm the director of a school-based mental health program in Prince George's County, and we had to transition to telemental health services with our clients, and just the ability to be able to access and provide mental health care to them while they're in their homes has been just a tremendous support for those clients. And I'm surprised we didn't use it as much before as we're doing now, because it really provides an opportunity to really make sure clients are connected and engaged, and just makes it easier to access services. And obviously if we go back to disparities, that still is an issue for some families, and that, they may not have access to the equipment that would allow them to engage in telehealth services, or may not have, Wi-Fi, or again, if you have to, if finances are tight and you have to make a decision between Wi-Fi or food for your family, you're probably going to go with food for the family.
Yeah.
So, there's still some access and equity issues we certainly need to address, but it definitely has been helpful means of being able to ensure that most clients are able to get the services that they need.
Yeah. I was wondering if you might have a suggested resource or book around cultural competency that you might recommend to our listeners.
Oh boy, there's lots of resources out there. I would direct our listeners to our website, www.blackmentalwellness.com. There is lots of information on our website about various mental health issues. And then on our social media platforms on Instagram and Facebook, you can find lots of information there as well about a range of different issues. We have different themes that we focus on every week, but you can find lots of information there.
Great, and I'll include links to all that in our show notes for today's episode. You've been generous with your time, and I want to be mindful of that, but I was wondering if you might have some parting words of wisdom for our audience that you'd like to share.
In these difficult times, I would say one thing that has been really helpful, well, 2 things that have been really helpful for me. One is finding something every day that I'm grateful for. So the practice of gratitude has been a tremendous help and assist to me in these times that we've had to make so many changes and adjustments to our daily lives. I think practicing gratitude is always beneficial. And secondly, I would say, all of the events over the past several months have certainly created a flurry of emotions for most people. And I think it's important to take time to really get in tune with whatever it is that you're feeling and experiencing. Acknowledge it. Don't try to avoid it or stuff those feelings down. But then also develop some helpful coping strategies, thinking about how, this COVID isn't going away anytime soon. We're going to be talking about issues related to racial injustice and racial trauma for some time, experiencing it again for some time. So developing your own kind of personal toolbox of coping strategies, I think, can be helpful for everyone, whether that's just breathing, engaging in some mindfulness activities, or perhaps getting more engaged in the movement and taking active effort in creating change. But doing whatever feeds your soul, I think, can be helpful during these times.
Wonderful advice, great suggestions, and good information. Dr. Cunningham, it's been an absolute pleasure to talk to you today, and I really appreciate you being on our show.
Thank you. Thanks again for having me, Mike. It's been a wonderful conversation.
Yeah, let's do it again sometime, okay?
Sounds good.
All right. Thank you so much.
All right. Thanks. Take care.
You too. Bye-bye.
All right. Bye-bye.
We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners or New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.